Hey everyone, thanks for joining the Amplitude of Tech podcast. I'm Shawn Cordner, Chief Marketing Officer of Amplix. Today I'm joined by Patrick Chilcott of Riverside Behavioral Health. It's a great conversation. He talked about what's going on in the healthcare industry at large, as well as the behavioral health industry specifically. But if you're not in those industries or not interested in those industries, you should listen anyway. We talked about a wide range of things from AI to cybersecurity. I think it was a really great one. This is our first time on the podcast talking to an end user client. So this one's a little bit different. I hope you stick with it and join us. Thanks. All right, Patrick, thanks for joining the podcast today.
Yeah, good. Thanks for having me. Appreciate being here.
I know it's you're just getting back from the holidays, most likely, and trying to get back in the swing of things. So for you to give up a little time on your Monday is probably difficult, but I really appreciate it.
Yeah, no worries. I appreciated the fact that you guys asked. We're excited to do it and talk to you guys today.
So you're actually the first end user that we've had on the podcast. So far, it's been technology experts and subject matter experts from different providers that we work with. Now we want to start to bring the voice of the client to the podcast as well. So we'll start mixing it in. So we'll see how this one goes, and that'll determine if we do more of them. Hopefully,
It sounds like a lot of pressure, Shawn. I don't know. I don't know that I'm the right first one, but hopefully you're not disappointed.
the future of our podcast is on your shoulders today. So maybe just take a moment and just tell the audience, who you are, what you do.
Sure. So my name is Patrick Chilcott. I'm the Chief Financial Officer with Riverside Community Care. So we're a behavioral health nonprofit headquartered in Dedham, Massachusetts, about $140 million in revenue. We were founded about 45 years ago now. And we've grown both through acquisition and organically. We've been in the location we're at now for about 7 years, but we run a wide range of programming in the behavioral health space, right? So it's everything from traditional outpatient services, so people just come in and get therapy, to substance abuse services, child and family services, autism, early Head Start, early intervention. We have a whole group of residential facilities and residential folks, as well as a community living services group and a suicide prevention component to the organization. So we really do run a pretty wide gamut. We serve almost exclusively Massachusetts, specifically Worcester East in there. But, from time to time, you'll get some folks from around the Commonwealth. It's been an interesting time to be doing this, right? All through COVID and then post-COVID and what have you. But I've been in the finance space for about, it's 2026, so 38 years, so probably longer than most of your listeners have been alive. I've been doing some form of this work, but I had grown up in the for-profit space, right? So grew up in banking, management, consulting, high tech, those industries. So it was a little bit of a different path, I think, to get to the not-for-profit world, but it's been a great 6.5 years so far.
And why did you make the turn from for-profit to not-for-profit?
Yeah, I was at an interesting point in my career, right? And I could have gone back into consulting and management consulting, but there were really two main reasons, right? I really believed in the mission at Riverside, right? And in that sort of community-based behavioral health services and centers that are really in the community, helping people that sometimes wouldn't normally have the services available to them. So I think the belief in the mission was an enormously important driving factor. But our founder, Scott Bach, for anyone who will listen to this who already knew Scott will understand when I say this, he was a force and just a pioneer in the industry. I interviewed with him the first time, and at the end of the interview, I said to my wife, I'll sweep floors for this guy. I just want to work with him, right? He's going to be a lot of fun. So I think it was a combination of both the mission as well as Scott. And then candidly, I knew I was going to make a big difference. Just, in our space, it's really hard sometimes to really recognize the need for deep talent. And, you don't have to settle, right? You can actually go out and get the best and the brightest and the most capable at not just the executive level, but your managerial level, your VP level, and really drive home a strategically focused business. And I knew I was going to be able to make a difference at Riverside. And I think so far in the 6.5 years that I've been there, that's happened.
I think that's a challenge that you see a lot in the nonprofit space is attracting talent, top talent, because top talent wants to get paid top salary, and typically not for profit is not in a position to be able to do that and attract and retain that kind of talent. And I think sometimes you see that in the government space as well, although um, on both sides, what probably draws that talent in is the duty to serve in one way or another, right?
Yeah, I think that's true. And I think it becomes more than about the paycheck, right? I think it's, there's usually two, what I'm finding just in hiring, especially at more senior levels, you get folks maybe like me that were kind of in the back nine of their career. I did the 80-hour work weeks. I commuted to Sweden. I commuted to the UK, right? I did a lot of that as I grew my career. And I was at the point where I was looking for, candidly, a better quality of life. I want to spend a little time with my kids before they were off kind of doing their own thing. And in making the jump, well, look, I still work really hard, allowed me to do that. So I think you have the folks maybe are on the back nine of their career. I also think that you get folks that are ready for the next jump or the next elevation in their career. And a lot of times a not-for-profit will take a chance on somebody who maybe hasn't had the role for an extended period of time. But if you've got talent at the senior levels that are willing to train people and are willing to build the bench and make an investment in people, man, it pays huge dividends for the organization.
Yeah. That kind of leads us to the turn maybe to the technology space here. Talked about nonprofits not really having usually the margins to be able to
Yep.
pay for top talent, right? So your space in particular in the healthcare space and the not-for-profit healthcare space notoriously has low margins. They're always being squeezed. There's always challenges. Right now, the world is facing some macroeconomic headwinds. Here in the US, there's been changes to state and federal funding, challenges in the insurance space in terms of reimbursements. So, how's all that impacting your industry right now?
It's a huge impact right now, right? And I think what it does is it forces strategic planning at a completely new level, right? So whether it be federal funding or state and local funding or, to your point, the insurance reimbursement components, all of those things are having a huge impact across the behavioral healthcare space. But I also think we embarked 6 years ago on a strategic journey that said we have to do better because everything we do from a technology lens, a finance lens, an HR lens, all those back office operations directly impact quality of care and the ability to truly, you know, be proud of the care that you're given. So one of the things we strive for is, would I put my family member in this program? Would I be okay with my son, my daughter, my wife, my mother, my father being in this program? And if the answer is no, then you have to do better, right? You just have to do better. And I think interestingly enough, a lot of not-for-profits, well, yes, the headwinds on the direct revenue are tough. We're also not real good at negotiating the back end types of things, right? The back end contracts, putting things out to bid. We've saved well over $2 million just by doing that in the last 6 years, right? And then that's all money that is opened up to reinvest into things that are important, right? So whether it be all the cybersecurity protocols that we put in or the network monitoring things that we put in, the upgraded just internet capabilities and geo netting and firewall capabilities were all done through savings that we generated. Ironically, Amplex was part of that for us. It wasn't the only arm, but it was a big piece of it, especially in the mobility space. It really helped us save a tremendous amount of money.
About identifying what are the right areas of your technology ecosystem that might be ripe for savings or leveraging technology to create savings other places in operations.
Yeah, I think it's the way we did it, right? It's no secret sauce, right? Some of it's just logic. Is where are you spending the money?
Mhm.
all at the end of the day. And when's the last time that you actually put something like that out to competitively bid? So I'll give you a really kind of concrete example. So I was at Riverside probably 2 years, and I realized we had never put our mobile phone business out to bid ever. Right. And we're hearing a lot of, well, you're on the state contract, so you're getting a great rate. And, it's going to be really hard to beat this rate. Or, that my mobile phone company, I won't say who it is because I don't want to disparage anybody here either, would be like, well, hey, look, we're going to give you a $10 per line discount. Well, I looked at it as I'm spending close to half a mil. Well, at the time, it's close to $800,000 a year on, on mobility expense, right? And I'm thinking, there's no way you don't put that out to bid, especially every 3 or 4 years. We had never put it out. So I dropped the rate for that from $800,000 a year to $400,000 a year when I put it out to bid because, well, and I came off the state contract because I did better by doing that, right? And the services were the same, the benefits were the same, but the pricing was just way better. We did very similar types of things when we were looking at our firewall expenses and just some of our traditional network expenses. You know, just putting them out to bid and getting a competitive bid provides leverage and allows for better negotiating capabilities for the organization. We've done it with our janitorial services. We've done it with a whole bunch of sort of maintenance services and that type of thing. Saved a lot of money there. We did it by going out and establishing Amazon business accounts and putting our office supply vendors out to bid, right? So it really was about spend for us. But in the technology space, especially, we had never put anything out to bid. So our vendors were like, hey, whatever we tell them, they're going to pay.
Mm.
And sometimes I think some of the vendors were just pulling it out of thin air. And we were like, oh my God, thank you very much for being our vendor. That's where too my private company experience really came into play, right? So I was the CFO for a $2 billion procurement division of a major financial institution. So I knew how these things work, and I was able to bring that sort of to the forefront and negotiate much better rates in some of these areas.
But someone that's sitting in your seat that's looking at their entire stack and all the operations of the organization, you have to pick a place to start, right? So is it like the old saying, why did you rob banks? It's where the money is. Do you start where the biggest spend is?
You start where the biggest spend is. And you find partners, right? I think that's the other thing that's super important, right? So when we were starting this journey, I had no idea who you guys were, for example, and who Amplex was as an organization. And back then it was Net7, and I was pretty skeptical. I'm like, what do you mean you do this stuff for basically free? And what do you mean you kind of go out and help me get this stuff implemented and you offer all this ongoing support? I just never heard of the model. And I kept saying, I don't get it. What's the catch? Right. And what I learned is there wasn't a catch. This was about really finding a partner that was willing to be in it shoulder to shoulder with me. Right. And then use your leverage, my skills, your skills to just get a better deal. But yeah, you go to where the money is. And if you're spending a lot, chances are you're going to save a lot. Right. And that's sort of how I looked at it.
I spoke to the CIO of a pretty large hospital system down in the Delaware Valley earlier last year, and she was talking about the pressures, the economic pressures, and the razor thin margins, and she was talking about how a lot of doctors are starting to go to quality contracts, and I'm bringing it up because you said, I forget exactly the term you used, but one of your key performance metrics that you live by is patient outcomes.
Hmm.
Um, would you let your family go into this system or this
Yeah.
program,
Yeah.
right? And so I think the logic is that some doctors are saying, well, I'm a good doctor, I get good patient outcomes, and so if I put a little in on the table and I perform well, then I'll get better reimbursements, and that generates more revenue for the business. And what she was saying was that one of the biggest challenges to performing at that level is patient compliance. And so they're starting to leverage technology to ensure patient compliance. using AI, for example, to do outbound calls or texts or emails to say, did you get your blood work? Or, hey, it looks like you didn't fill that prescription you were supposed to refill. What's going on? Can we help you? Something like that. Have you experimented with technology in that way yet?
Yes and no, I think is probably the answer to that. So first of all, outcome driven care and outcome driven reimbursements isn't even really going to be optional going forward. This is just something, you know, the Commonwealth, through its community behavioral health initiative, in the community behavioral health centers, the CBHCs, are very much outcome driven, right? So it's not about necessarily about, did you see this individual? You get a bundled rate, and all the services that are performed are covered under that one rate for that day. And then there's a series of outcome measures a lot of times that you have to actually show and prove in order to retain a certain rate. So I think that is 100% the wave of the future. What we've started to do is look at things like using AI driven technologies for notes and in completion of notes, which is directly needed in order to bill something, or bill an insurance component. We've also started looking at different technologies for appointment reminders and text reminders, and to really reduce our no-show rates and that type of thing, as well as remind folks, hey, not only do you have an appointment, but you have a follow-up appointment. Or it may even go a step further of, you indicated that you have a medical appointment that you need to get to, because that is beginning to commingle more in the behavioral health world. So, those types of technologies that give sort of the reminders, the ability to pay electronically, those types of things, we absolutely have started to use. And we're just getting to the AI driven note taking component to it. It can be expensive, which is definitely a barrier of entry, but it is something that is the wave of the future.
Sure. Now, the delicate balance that I think you have to strike here is, particularly in your industry, you're dealing with people that are in a delicate state, and these are sensitive conversations that you're having, or sensitive subjects, and big stakes potentially as well. So how do you balance using technology for that operational efficiency, or for improving patient outcomes, with staying human centered and patient focused?
First of all, that's an incredibly intuitive question. So I give you a lot of credit. Clearly did some research on the industry, which I really appreciate. So I think you're absolutely right. I mean, there are levels of care that are required, and you're not sending appointment reminders to somebody who's in crisis. I mean, let's be real. That would just be almost negligent, silly, whatever you want to call it, right? So you're using sort of that technology for the everyday therapeutic, regular, therapy, psychotherapy types of visits. Everything, when you get into crisis related care or more critical acute related care, is all person to person at that point. You're never going to have a machine or a piece of technology that's going to be able to supersede that. And candidly, you can't, because those clinicians are trained in ways I'm never going to be able to understand fully, to actually see things or identify things well before any machine's going to be able to pick up on it. And you need that interaction in order to figure out what's the right next step. So you may have someone in crisis who may need to go into a community crisis stabilization type of setting, which is like a week to 2 week, almost inpatient type of thing, to just get them over the crisis in order to then step down into other forms of care. And that 100% is a person to person or an individual type of setting that no technology is going to supersede. However, technology on the back end of that, right? In order to, store the note, make sure the billing gets done, make sure that you're doing all of the requirements so you can bill that appropriately and generate the revenue to continue the care. That's where the technology actually comes in those scenarios, that I think for us has been really helpful.
This is maybe more of a bias towards the way that the consumer market talks about AI, but I think there's a perception out there that AI is the end goal, or is the end state, right? And I think it's important to talk about AI as the tool to achieve an outcome, or to achieve an end state, right?
Yeah, I do. And I think I would say AI is no different then an electronic health record, then a general ledger system. It's another tool in your arsenal, right? To help make things more efficient and effective. So, there's a lot of things we can use AI for. It could be policy creation. It could be even to help sort of with the note creation, which takes clinicians a long time to do, that you can then have an individual review and sign off on and approve. But that frees up time for more face-to-face interaction, more, human interpersonal sort of interaction where it's needed and necessary. But yeah, I agree. It's simply another tool in the arsenal.
Yeah. You've talked about AI note taking a few times now, and I feel like that's a textbook example of um, a high leverage area where you can implement AI. And that's a good uh, way of thinking about approaching AI projects, because a lot of people are at the starting line still with AI and thinking, well, where do I start? And maybe they got Copilot off the ground, or, maybe they're using a chatbot on their website or something like that. But really looking at operations and seeing, where are we spending a lot of time? Where is there a lot of room for error that we might be able to reduce some of that noise in the business? And have a measurable impact in productivity and ultimately patient care in your situation.
I could not agree more, right? I think that's an example. I mean, there's so many examples I think out there where you can actually use AI. Um, but if you think about it, right, if a clinician sees 10 people in the course of the day, that's 10 individual notes that ultimately have to be written. And if your tool can actually set it up so it's like, look, I've got these 50% done or 60% done, and then the specifics have to actually be entered by the clinician. That may save that individual an hour, 2 hours a day, right? And it's not just in the behavioral health space, right? So my daughter's a physical therapist. The one thing I hear from her constantly is tired of writing notes after I've already worked all day, right? Like I have to stop and kind of do it, whether it be in that clinical setting, in a hospital setting, right? More and more we're seeing doctors, we're in our physical and our doctors actually talking into a microphone about what's going on. That's all for the note. It's all to kind of push that forward. But he doesn't have to worry about sitting there typing. He can focus on me as a patient and what I'm saying and what some of the things are. It's more accurate and it provides more face time with my doctor or my clinician. That's a win for everybody.
Yeah. Two total tangents that probably don't have much practical application to people listening, but I'm going to ask anyway. Um, do you ever see, or is there any talk in your space of AI actually becoming the therapist or a first line in therapy?
I don't think we're close to being there. I mean, I just don't. Now here's where maybe I'm biased, right? And candidly, I might just be a little too old, right? But 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 I don't see the Star Trek holodeck kind of producing, a medical AI or a therapeutic sort of hologram for somebody to talk to and what have you. And part of it is like AI is great, but it's simply an amalgamation of information and data that is regurgitating everything that it has learned and brought forward back to you. Especially, I would say, in the behavioral health space, you need clinical capabilities and expertise to really understand the why and the what, right? That's actually happening. So I don't, and candidly, I don't know many people that would be open to just talking to a machine about kind of what's going on. It's almost just too cold.
Sure. Sure. Although it's pretty good at being complimentary to you and making you feel like you're the smartest guy in the room. So,
Yeah,
and
I think that's true, right? But well, here's the other thing though, too. You know, if if you've got a case that might be a little unusual or somebody's presenting in a certain way and maybe you're not as deep, you certainly can reach out to sort of an AI tool to say, hey, this is what I'm seeing, this is what I think, bring these together. And it may direct you into sort of a path of care or a way to kind of collaborate with peers and say, hey, I'm seeing this here, but and I'm seeing this in the patient. What do you think? And it may actually further care quicker, right? As opposed to, having to do a lot of the research and sit there and do a lot of the research as a clinician yourself. So that's where I think there's a direct care link in with some of the AI tools.
Yeah, I can't help but wonder if it was programmed with some of the principles of psychotherapy and psychoanalysis in mind, right? Like it always has what is it, unconditional positive regard when it engages with you. It practices active listening. It always kind of restates back to you what you said to it, right? The other question, again, a tangent, but you kind of alluded to this idea of holistic care, right? How mental health, behavioral health is starting to bleed physical health as well, and they're connecting. So that's always been a challenge, I think, in the healthcare space is that you're supposed to rely on your general practitioner, I guess, to be the quarterback of your care, but there's something lost between the general practitioner and the different areas of specialty, including things like behavioral health. Um, and I think part of that problem is that there's not interconnectivity between the different healthcare platforms and the systems that they use in these different specialties. Is there any talk about making that more of a flat type of a less siloed
Yeah.
data structure?
So it's interesting, right? The interconnectivity or the interoperability is what we call it a lot within the industry, right? Is becoming more and more common. So just as an example, right? One of the requirements in a couple of our contracts with the Commonwealth are we know if someone's been hospitalized, right? So we actually get an alert. So if you're a person that we serve, which we don't actually call people patients either, right? We call them person served. So if there's a person that we serve and they go into Mass General for a medical issue or a behavioral health issue, we'll get an alert. So because whether it be a medical issue or a behavioral health issue, that can raise anxiety levels, it can raise concern, it can, throw somebody into a bit of a spiral, that type of thing. So that's becoming a common type of thing, I think, within the industry. I think the blend of behavioral health and medical is happening to a certain extent, but the special that think of it as one's literally physical and one's behavioral, right? So they are still very different, specialties and what have you that I think complement each other more than they maybe intertwine with each other. Now, I am not a clinician, right? I'm a finance guy. So, that is my own sort of way of looking at it. But I do think, though, you are getting areas like our behavioral health community partner services where we will help people get transportation to medical appointments, for example, or we will, make sure that folks are aware that they've got certain things coming up. And almost to your point, armchair chair quarterback holistic care as well as behavioral health care, right? So some of that is absolutely starting to happen. I also think, though, the Commonwealth is at more of a forward-looking cutting edge than I would say most states in the nation are today. And I think that is a direct result of the Commonwealth holding behavioral health care as an important component of just wider holistic care than you would see in many places around the country today.
Sure. Yeah, that makes sense. I want to pivot back to technology now. Uh, we talked quite a bit about AI. You can't really talk about AI without talking about cybersecurity and governance, and in your industry, especially being heavily regulated, compliance. So, how do you think about your cybersecurity investment and governance and compliance?
I think it is one of the single most important factors that every CEO, CFO, CIO, and COO have to really be thinking about and constantly pressure testing, right? So the reality is, even from when I started at Riverside 6.5 years ago to today, the cyber threat landscape is completely different. I'd argue it's completely different than it was 6 months ago. And ironically, AI is making it harder to actually detect some of those things. So sometimes the human eye isn't going to be able to spot it. And that's where you absolutely need the additional services and the additional technology protection. So it is, I would say about 5 years ago, it became a main strategic focal point for us at Riverside. And I think that really the industry really began to shift. I mean, I've actually spoken at a couple of conferences about this since then. And we chose, and we basically looked at it no different than I need a financial system, I need cybersecurity protection, right? So, making sure that we had network monitoring, making sure that we had the right firewall protections, making sure that we had the right geo netting and sort of the right algorithms. And this is where AI can actually help you, right? Identify a threat or identify a potential threat, the ability to quarantine those things so they can't branch into your wider network. And then the use of better cloud services, which candidly are its own protection just by the mere fact that you're getting the protections, whether it be Amazon Web Services or Microsoft or whomever you're actually using. For organizations like ours, their protection is going to be far deeper than anything we're going to be able to do. But it's about layers of security, right? Is I the way I explain it, because I teach a class at Riverside, and this is a piece of it, is cybersecurity is like layers of an onion, right? You can start with something as simple as Outlook and Outlook scanning and everything else is the first layer. Then it's what's my firewall preventing and what's it ultimately preventing from getting it in. Then it's if someone gets in, what's the actual threat? How are they quarantined? And then it's how well do I test all of this stuff together just to make absolutely certain that I know where my vulnerabilities are and I'm constantly shoring them up. Because the other thing I say is we've got to be right 100% of the time. The bad guys only have to be right once. And
Yeah.
that's, I think, the hardest piece of it. But this is, I would say, in all of the organizations I talk to in this industry, this is one of the primary focuses and has been for probably at least 24 to 36 months. And it's only getting a greater emphasis, not a lesser one.
You just hit on the big problem, which is you have to write 100% of the time, but you don't have infinite money to throw at this, right? So you're really at an asymmetrical disadvantage because there's just so many actors, and some of them are state actors that are
Yep.
investing unlimited funds in these kind
Yep.
of attacks, right? And likely seeing an ROI on it. So, how do you actually quantify risk and determine the right level of investment?
Well, I think if I could perfectly answer that question, I might win a Nobel Prize, to be honest with you, right? Because I don't care if you're a $200,000 small behavioral health center or you're a $3 billion organization. That is the magic question, right? I think at the end of the day, for me, right, and IT does eventually report into me at Riverside, so I can say this with some level of authority. It's about, do I have enough redundancy to actually identify a problem? And then do I have the capability to quarantine the problem? So I'm not going to pretend that we're not going to come under attack because whether it be through something as simple as phishing or outright attacks into the network, there are multiples of those a week, right? It's, do I have those right layers in that can prevent, can detect, and then can isolate and quarantine? And if that's your answer, you're probably doing everything you can. But then there's a fourth element is, do I have the right insurance? And am I protected from a fiduciary and a financial perspective? So I run a consortium of CFOs for the Association for Behavioral Health. And we get together quarterly. And we've spent a couple of sessions talking about this. And I was amazed how few people were able to tell me, are you adequately insured for a cyber event? A couple were like, "Well, isn't that just covered under liability?" I'm like, "No, it's its own type of theft and is very different." So I think it's about prevention, detection, and then quarantine, and then if something does come, am I protected from an insurance perspective?
Yeah.
And having, sorry, just one more thing, making sure that all your systems aren't tied to one central location that has all the data, right? Making sure that you've bifurcated things enough and that you've segmented data enough that a threat actor couldn't do huge damage if they did get in or couldn't exfiltrate, which is where I think the cloud is so helpful.
Yeah. And I was going in that direction anyway. What I was going to ask is, one of the terms that you're starting to hear more and more is cyber resilience. And I think it's this idea of cybersecurity layered with cyber insurance, layered with remediation and being able to restore the business continuity and recovery, right? So that seems like that's got to be a key investment as well, as making sure that if something does go wrong, you know what's going to happen the minute you find out, and how are you going to make sure that you can get that data back up?
Yeah, and do you test that, right? So do you actually run, we grew up in an era where fire drills were pretty common, right? As a kid, you ran the fire drill in school. Your business used to run the fire drills all the time. I'm old enough to actually remember duck and cover, right? Which, again, most of your listeners won't have any idea what I'm talking about. But you do need to run sort of a cybersecurity fire drill, at least once a year. And there are multiple organizations out there that will walk you through it and help you do it. And they'll come up with things, be like, okay, so what do you do? How do you react? Who do you call? When do you access it? Right. But I do think it's the layers of security, coupled with testing those layers of security and constantly be willing to remediate if you find weaknesses.
Yeah. Yeah, these are all, we recognize at Amplix that these are all, critical components, and really that security needs to be embedded in everything in
Everything.
technology now, right?
Yeah.
We, to the point that we just acquired a managed security services provider called 24/7. And one of the things that, they talk a lot about something called defensible cybersecurity, which is this idea that uh, CIOs can defend the investment that they're making to the board and to the CFO. So from your perspective, how do you measure ROI on the cybersecurity investment?
So it's a fantastic question. Interestingly enough, my CIO and I are going to have this conversation in about a week as we prepare for budget season kind of coming up. And there are going to be some things that we're going to have to kind of look at and think about a little differently, because it's not a traditional ROI, right? It's not, if I make X investment, what's my payback? The question is, if I make X investment, how well am I protected? Right. So honestly, I look at it as, I've made these investments. How many times did I have a breach or a real issue? Because remember, the amount of liability that carries can be massive, right? And your cyber policies generally don't cover that, right? That's where your other policies are going to kick in. But at the end of the day, if I'm spending, call it $500,000 a year, and it's finding the breaches, or it's saying, hey, Patrick just logged in, right, from Dedham, Massachusetts. But then Patrick logged in from Nigeria, and Patrick logged in from Dallas, and Patrick logged in from Minsk, Belarus. Patrick gets shut down. You know what? That's worth the $500,000 to me, because that was a threat or a problem waiting to happen. And the other way I look at it is, if I make a reasonable investment, and I do need, because everybody's level of reasonable is going to be different depending on the size and scope of their business. But if I make a reasonable investment, can I protect the data of the people that I'm serving? Because that is a fundamental requirement of us as an organization. And can I make sure that my people are trained, my people understand it? Because honestly, as good as AI is and as good as all these other things are, phishing is still the way the majority of these folks get into your system, right? So, making sure that you've got that sort of detection, I think, is really important. But you're never going to be able to measure an ROI on that investment by the return. You measure it by the lack of issue.
Sure. Yeah, and people are always going to be the low hanging fruit for bad actors.
They're
And
your
actors.
main weakness.
Yeah,
Yeah,
so social
that's right.
engineering, right? That's the way to go. And so I guess investing in education and training and ongoing testing, and we always get these random emails that are phishing attempts to see if they catch us falling for it or not.
Well, we do it all the time. We literally do it all the time. And look, and I don't even know when we're doing it, to be honest with you, because I've sent things in to my IT team. I'm like, guys, I think this is fishy. And I got oh, you passed. I'm like, oh, thank God. Because if I start to fail, we're all in deep trouble, right?
Yeah, exactly.
And honestly, there's a very small group of people that know when those are being done for a reason. But yeah, I really do think everybody's got to figure out, it's no different than any other kind of protective services, right? what can you afford, but what can you not afford to lose, right? What can you not afford to have a problem with? And then those things have to merge together to get you the best protection possible.
So that leads me to maybe a bigger question. And I think you've given an example of this, but what advice can you give the technology leaders that are listening on how to have a productive and collaborative relationship with the finance department? And do you have any insights on, what's the best way to present a business case that's going to get them the investment that they're looking to make?
Yeah. So I think, honestly, first of all, I don't think it's about focusing on the dollars and the money first, which is what everyone goes to. I think it's about explaining the problem, right? Because look, I spent a lot of time in the technology industry, so I probably know a little bit more about this stuff for a CFO than most CFOs are going to know. So I may be pushing more than what most CFOs would push. But first, identify what the issue is and what the problem is and what the risk is. Because any good finance person is going to take a risk based approach in almost everything we do, right? So identify the risk, the issue, and the problem. Then identify the solution and talk about how that solution ultimately can be paid for, right? I mean, I hate to go full circle on what we talked about 50 minutes ago, but where can I generate savings? Where can I negotiate better rates? Where can I generate dollars in order to basically reinvest that back without increasing my expense base? And then look, I'll say something just directly to the finance folks out there. You have to accept that you got to pay for some of this stuff, right? Because having a problem is going to be far worse, even if you have the insurance, right? So there are firms that have had issues that did not have access to their network for months, right? So imagine writing out checks to your vendors by hand for months. Imagine keeping medical data on paper for months. The amount of risk and the downtime and productivity and everything else there is huge, right? So I do think some of it is about it's like any other insurance policy, right? You're actually guarding yourself from a much wider problem and a much wider issue. But focus on the problem, focus on what the right solution is, have the right partner that knows the space so that you're not, you're not basically buying a Yugo for the price of a Mercedes Benz, right? So have the right partner that can help guide you through it and then negotiate. That's, the other thing I'm going to say, and I think is really important, especially for folks in my industry, is everything's negotiable. And a lot of organizations want to break into our industry and see us as an untapped industry. Use that as leverage, right? Or go out and get two or three other organizations similar to yours to go put a bid in together. It's even a bigger sort of consortium buy type of thing that just gives you greater leverage because the more you're buying, the better the deal.
Yeah, that's a great tip. So I want to say it back to you, what I think I heard. Um, Explain the problem,
Yep.
quantify the risk, maybe come with ideas to offset the cost. So it's gonna cost me a little more here, but I'm going to tighten up our mobility spend over there and
Yep.
absorb some of that cost. Find the right partner and get better at negotiating.
That's exactly right.
Yeah, great, great tips. I want to move to. I read this article, 2024 article by the American Psychological Association, and I'm just going to read here. They reported that the cost, stigma, and provider availability remain barriers to people getting access to healthcare and mental health, behavioral health. Um, in your mind, can technology investments democratize mental health care and help bring costs down and improve availability?
Sure. First of all, access and about provider availability is a huge issue, especially in the pediatric space or the kid space, right? Anybody who's looked for a therapist for their child knows it is really hard. I mean, it's just really hard, right? And that's where telehealth kind of comes in and can be, at least for those initial types of visits or maybe the less acute types of visits, right? Telehealth can work wonders. and for traditional outpatient services can absolutely open up access because while the clinician may need to be licensed, for example, in the Commonwealth, that they get licensed and are licensed in the Commonwealth, right? They can be anywhere in the Commonwealth, right? And in some instances, in other locations, right? So I think that's where technology can play a really big role. I also think um, making the back end more streamlined and easier actually does lessen the cost of the overall care. So I think that's another big piece of it. I think access is always going to be a struggle, but I think organizations like Riverside that really focus on underserved populations and get into the community are ways that that access does open up, right? And I think continued lobbying for organizations like that is really important. And you would think, okay, well, you're the CFO of that organization, you would say that, but the reality is it opens up both access as well as equity and care. And I think that is really important. But I think that the technology space with telehealth, the technology space with ease of delivery, with payments, with scheduling, with reminders are all ways to ensure people are actually getting the care they need. And they affect the outcomes as well as the quality of care.
Yeah, I would have to think unless you were, a renowned doctor, you would have a geographic limitation of how
Yeah.
far people are willing to travel to see you, right? But investing in mental health, you would be able to expand that reach and attract new markets, which on the other side has the benefit of making a service available to people that otherwise wouldn't have something in their market.
There's also a practical side, right? So think of a behavioral health clinic on Nantucket or Martha's Vineyard or Block Island, right? These are geographically secluded. There are only so many year-round residents of these organizations. So now those residents have to have a master's degree and a whole other series of clinical training in order to actually provide services. Forget an actual um psychologist or psychotherapy, right? Just general clinicians, you've got to branch out geographically from those and have the ability to do that. And it's actually what makes a lot of organizations in places like Martha's Vineyard and Nantucket viable, because you can have someone living on the Cape or living in New Bedford or living in Boston or Dedham or anywhere else that can actually deliver care.
Yeah, and if let's say you increased your business by 10%, how do you fit that in? Well, by leveraging something like AI for note taking, you can free up the doctor's time to have more face time with patients or
Mhm.
people served, right? You can streamline the back office processes so that you don't have to scale the back office along with the patient growth, right?
That's exactly right. And I also think, again, right, it's about how you bring these things together. Any one thing gives you a small piece, but combined, it's like the sum is greater than right? The whole is greater than the sum of its parts. That, is where I was going with that because all of a sudden these small incremental things yield a much bigger result. And that's where honestly your ROI comes in, right? Because any one thing is only a component, whereas together it's exponential. Whether it be greater revenue, lower expenses, as a result, better bottom line, better access to quality labor, sort of all of those things.
Sure. What are some big changes that you see coming in your industry or the broader healthcare sector over the next, say, 3 to 5 years? And how are you preparing for them now?
So look, there's no doubt that what is top of mind going into the coming fiscal year is really what the federal, sort of reimbursements are going to be and what federal funding is going to be, right? So, you could have, I think it's like $13 billion is comes into the Commonwealth and Medicare and Medicaid funding, right? That gets cut, that cascades through the entire segment and the entire system that could be detrimental. So it's how do you start to prepare for that, right? How can you make your operations more efficient, more effective in order to sustain some of those things and not directly affect your labor force, as an example? So I would say the federal funding pieces of it, it's it's all what we've talked about for the past probably 3, 4, 5 months, right? and it's real. What do the changes ultimately mean, right? So, there are different work requirements. When do those kick in? Who's exempt, who isn't, and be able to sort of react to that. Interestingly enough, the ability to reach out and communicate with people about Medicare changes and what that looks like and how to enroll. And if you have to re enroll every 6 months, you have to have a way to communicate with your base that is affected by that. And that's the other place technology plays a huge role. So, can you communicate via text? Does it have to be email? Can you use AI to send reminders and sort of that is going to be a huge component for fiscal year 27, which for most of us starts July 1 in the remainder of fiscal 26, because a lot of those requirements started January 1. So I think those are things that are absolutely top of mind. And then it's, how do you operate in an outcome-based payment structure, right? And what does that look like? How do you have the data infrastructure in the reporting infrastructure to be able to quantify those outcome requirements and those outcome-based requirements? So we spent the last couple of years building a pretty extensive data warehouse that gives us productivity KPIs and measures and outcome driven measures and what have you that we can report on to the funder community in order to grow our rate structure and to prove what the outcomes have been. And that's another area that I don't know from an industry perspective that we're looking at deep enough as far as that data warehousing capability, the business intelligence capabilities and those types of things.
Y- You said that there's $13 billion that come into the Commonwealth of
I
Massachusetts,
believe that's correct. Yeah.
and that's just the federal funding. So potentially some, or not all of that, but some significant percentage of that could go away. That would obviously impact your ability to operate, and you have to prepare for that. I'm wondering too, though, with the increases in health insurance, I imagine people are dropping coverage because they simply can't afford it, or they're getting worse coverage, right?
Yeah, I'm actually glad you brought that up because it's the other thing that I would say in the last probably 4 or 5 months, we had an entire that consortium that I chair for the Association for Behavioral Health. We've literally had 2 full sessions on new creative ways to deliver healthcare to our employee base, right? So, at Riverside, we were fortunate that our costs only went up 16.7%. Most organizations were seeing 24, 25% increases. But understand that's millions of dollars, right? On a fixed revenue base, right? So it's not like I can, and that's the struggle in our industry, which you alluded to earlier. I can't turn around and say to Blue Cross, well, look, because you're charging me $7 million more here, I need to raise the rate that I charge you. They're like, no, we have a contract, right? This is what we're paying you. The Commonwealth is going to say, we have a contract. This is what we're paying you. And there's not automatic increases to that, right? I mean, there just aren't. So it's kind of like being on a fixed income and absorbing those costs. And that's where I think sharing data, sharing information amongst our peers has been so helpful, but healthcare costs are just skyrocketing. And next year's not in all the tea leaf indications are may not be this severe, but it's not going to be a whole heck of a lot better.
You're getting pinched from three sides, because you're also potentially going to see less people seeking care because they don't
That's
have
correct
insurance.
because they're not insured or they don't have the right levels of coverage. So think about it, right? If Medicare drops X percentage of folks, a lot of folks in our industry, that's how this is paid for. If you have to downgrade your health insurance just to afford the premium or the copay portion of the premium for your family, you may not get as many visits, or it has to be covered. I believe Massachusetts does have a requirement that there has to be coverage, but what you pay for that coverage may be something that you have to limit the amount. So if you look at the traditional sales funnel, right, from opportunity down to sort of closure, and you think of that from a person served perspective, that funnel is getting shorter and smaller and more narrow. So your revenue is diminishing while your costs are going up, and and that is literally one of the bigger fears, which is why driving efficiencies where you can and driving savings in your expense bases where you can with the right partners becomes even more important in this environment.
Yeah. And this is going to be the clickbait headline that makes us go viral here, Patrick. But are we going to see a healthcare apocalypse through all this? Everyone getting squeezed from all these different directions?
I don't know if it's an apocalypse or at least, it's going to be um, a tactical nuclear problem, but one or the it's not a sustainable measure, right? And there's absolutely no way. And there's going to be a point where it's going to take some form of congressional action in order to really stabilize the healthcare segment and healthcare sector somehow. Because, look, at the end of the day, the insurer's goal is to deny your claim. I mean, I don't mean to be so cynical about it, but that's the reality. These guys took a bath on the GLP-1s and the weight loss medication, and they're trying to make that back. I mean, that's the reality of and again, my opinion, solely my opinion. But you also unfortunately don't have as many folks going into the traditional medical industries and what have you from a doctor, medical, physical specialty. But when a behavioral health clinician is only making 75 or $80,000 a year, but you have to have a master's degree and you have the cost of getting that education sort of going up and skyrocketing. It is literally the perfect storm of collapse is what you're talking about. So I don't know if I would say apocalypse, but you are on the verge of collapse if something doesn't get done from a congressional perspective pretty quickly. And that's everything from, I think, tort reform to cost of education to actually cost and delivery of services and real reimbursement rates.
Yeah, and unfortunately, we're at a time where Congress doesn't seem very functional and has ceded quite a
Right.
bit of power to the executive. So it's not likely to come anytime soon. I wonder then if the answer might be that organizations like yours, which clearly you've gone in this direction, start to think more like for-profit businesses.
You
And
have to. I think you absolutely have to inject a for-profit mentality into organizations like ours. I think it's survival, right? But it's interesting, right? When I first came to this space, I didn't really understand what it meant, right? And candidly, I think the folks that come in from a for-profit space struggle for a couple of years because you're used to a much more rapid type of timeline, and you're used to a much more aggressive type of way of working. And one of the benefits of being in this is you don't need some of that, right? Like it's a different cultural experience. But I think bringing the challenge everything approach, the fresh idea approach, the ability to really think around the problem, a strategic, forward thinking approach to things, which you have to do in the for profit space just to keep your job, in mixing it with sort of that maybe more empathetic, I would say calmer way of doing business is probably the right mix. But yeah, if you're not thinking more like a for-profit organization in the not-for-profit space, you're probably about 4 or 5 years behind.
yeah, Riverside is a larger organization. How can small or mid-sized, healthcare not-for-profits get access to the same kind of senior level talent and experience and insights that a larger business like yours can?
Yeah, so I think there's a couple ways, right? Um, there's a lot of folks like me. I mean, I'm my own consulting, type of business on the side where I do some of this, right? So there's a lot of folks like myself that you can actually bring on a very part-time basis, which makes it very affordable to sort of not just challenge the status quo, but help you actually set up an infrastructure of a forward-thinking strategic way and bring the partners that we've developed to you in a way that you may not think about. And that's proven to be, I think, very successful. And not to do a commercial for myself, but it's real, right? And I think there's a lot of folks out there like that. But I also think it's about collaborating, right, with others within the industry and joining places like the Association for Behavioral Health, where you have access to so many more larger organizations that you can throw questions out and ask questions to. I think that's another way to go about doing it. And then bringing in the right third party vendors and third party partners that are true partners, right? So I look at a vendor and a partner is very different, right? A vendor is someone I get a service for, I pay, I move on. A partner is someone that I sit down and I'm like, here's my problem, help me think through it, right? Now, again, you guys at Amplex have been great with me, right? As far as that goes, Chris Checksfield and I have had many a conversation about ultimately what that will look like and challenged each other a little bit, to be, quite honest with you. He made me a bet one time that I wouldn't get to a final number. And he told me if I got to that number, he'd work for me. And so when we got to the number, I told him I was going to fire him because he couldn't get there himself. Right. But I do think you get that because you bring in the right partner that lend their experiences that you're not going to be able to just go by. So being willing to sort of bring in those fractional areas can elevate just your capability set immensely, right? And don't be afraid to ask for help. The other thing that I find in our industry is we have a tendency to accept mediocrity or accept, look, it's just not going to get better because we can't afford it, or it's not going to get better because we just don't have the money, as opposed to, no, it has to get better. We're going to make it better. And there are ways to do it. I mean, you can bring in for $20,000, $30,000, for $15,000, real high level talent for a defined period of time that can teach and guide and set up a strategy to propel you forward and elevate the capability set that you already have internally. That's the best way, I think, to go about doing it.
Yeah, I think that's important advice, right? Is to put your ego aside. You could be the best technology practitioner in the world, but you're only going to do so many technology transformation projects in a career
A hundred
where,
percent.
having the right partner like Amplix, and I don't mean for this to be commercial for us, but we do that many in a week.
Yeah.
And we've just done the reps and I do a little bit of powerlifting and you can't just go into the gym one day and deadlift 500 pounds, right? You need to do a lot
It's,
of reps to
it,
get up to 500 pounds.
It's 100% right. And I mean, if you think about it, I also do some powerlifting. When you go in, if you're going to pull a clean, if your form's not right, you're not doing anywhere near what you need to do. Or, you go to deadlift too much weight and you're going to throw out your lower back because you're just not going to lift it right. Someone has to teach you the right way to go about doing that exercise for success and for gains to ultimately happen. Right. And I think being able to say, "Hey, I need someone to teach me," that's actually the stronger, more confident individual.
I agree 100%. Bonus question.
Sure.
We have a good number of salespeople, both at Amplix and at the vendors that support us and that we work with that listen to the podcast, maybe some of our competitors just to see what we're up to. Um, but our typical buyer persona is an IT or technology buyer or CX, someone that runs the contact center, sometimes procurement, but we don't often go in through the CFO's office. So I wonder if you could give the salespeople listening some advice on how to get the attention of someone like you, and then how to speak your language and get them to go to the next step.
Yeah, I think a good steak at Mason's is always a good start, right? But I joking. I was just joking. But no, in all seriousness, I think understanding who your audience is and what's ultimately going to drive them. I mean, I think the hardest part is I get, I don't know, 40, 50 cold calls a week, right? Nothing drives me more bananas than that, right? Because I'm usually in the middle of something. The cold call rarely works, right? It's about figuring out someone that can make an introduction because, first of all, if somebody says to me, "Hey, Patrick, you really have to talk to Shawn. He knows his stuff. He was an enormous help to me doing this," that's worth its weight in gold because you're already credentialized in my eyes, right? Like I know you can do it. But I also think don't again, I go back to what we talked about earlier. Don't focus on the money first. Focus on the, hey, I know there's an issue out there and I can help you. It probably help you in a less expensive way than you might think. let me just go through it with you. Let me just talk about it. See if this resonates with you. That is way easier for somebody to kind of have a conversation about than, hey, I'm going to solve all your cybersecurity problems and it's going to cost you less than $700,000. Well, I might only want to pay 150, right? You don't even know that yet. So I really do think it's about knowing your audience and focusing on the problem that you believe needs to be solved, or simply say, hey, I want to talk to you about what those are, right? Because I know you're facing challenges, right? You got to put yourself in that person's shoes. I mean, think about everything we talked about, right? I know there's rate cuts. I know you're looking for expense reductions. I think I can help you with that. We just need to be able to have that conversation. But the referral, it's the greatest way to do it.
Yeah. Yeah. And by presenting the problem, it signals that you actually do understand their space and
Percent right.
that you have
Yeah.
experience.
And the other thing that don't treat like a behavioral health center like a medical center, right? As soon as they are, oh no, like I've got all these hospitals. I'm like, you don't know who I am. You don't know anything about me, right? Make sure that you really do understand the space before you try to make a pitch, and don't make a pitch too early. Because quite honestly, if you're always selling to me, it gets a little sleazy,
Yeah.
right?
Yeah. Exactly. Although I want to leave the salespeople with this word of caution, that doesn't mean don't cold call. I always say that um, if I happen to call you, Patrick, and you've got a fire on your desk and I'm selling fire extinguishers, I might get lucky. You might take that call.
Well, it's very true. I mean, ironically, I had a call like that just recently. And ironically, I blew it off, blew it off, blew it off. I'm like, okay, I'm just gonna get it over with and take the call. And it happened to be the exact thing that I needed at that time. And to your point, it absolutely did work out well. The other thing I would say is be personable, right? You buy services from people you like. I mean, at the end of the day, when you actually start performing services, get to know someone, right? Because you continue to employ and buy things from people you like. I mean, it sounds quirky, but it's true.
Yeah. And you mentioned Checksfield, and he's great at that.
I
And
was great at that.
he also just recently cold called his way into a gigantic retail operation that everybody listening to this would know. And the guy just picked up the phone, and Chris said the right things, So don't give up to the salespeople out there. Um,
That's true. That's fair.
Patrick, this was super helpful and insightful. I appreciate your time and expertise. Um, I think it went great. So I think we're going to have more clients on. So you set the standard high. I appreciate that. Where can people find you if they wanted to reach out and get your services or just ask you some questions?
Sure. Just for general services or that fractional CFO type of thing, they can reach out to Chilcott, Chilcott, consulting at gmail.com. Or they can even ring my phone at 781-234-8609. Generally probably have to leave a message because I'm taking a million calls a week. But yeah, I'm more than happy to help anyone out there that thinks that they might need some help, or help guide them through sort of some of the issues that they're having. So thanks for letting me do that, Shawn.
Yeah, I appreciate it. Thanks.
Thanks, guys. Take care.